to see you again, Joe. I was realizing as we were prepping for today's program that since our audience continues to grow by like tens every week, we should probably do a better job introducing ourselves at the beginning on why we're doing this. I think I skipped that the last few weeks. So anyway, I think we should start there, right? So let's get this kicked off properly. My name is Fraser Cobbe. I'm the executive director of a number of medical associations here in the state of Florida, and this program is the three healthcare headlines you need to know from Tallahassee. My partner in crime is Joe Daraskevich. Joe, you want to introduce yourself?
That's a good point, Fraser. We expect all of our fans know who we are, and they tune in every week. But you're right, the fan base is growing. So I am Joe Daraskevich. I work also for a number of medical societies and associations around the state, doing a lot of community outreach, doing a lot of sponsorship type stuff. But yeah, we get together every week and we kind of talk about the three big headlines in Tallahassee as they relate to the healthcare community. So we've been doing some preview ahead of sessions videos the last few weeks, and now we're really ready to dive in, right?
Yep. It kicked off this week, so let's bring our first headlines of this year's legislative session.
All right, here we go, Fraser. You ready? Here we go. The first one. The Florida legislature officially opened this week. Is this really a case of here we doge again? What is that all about, Fraser?
I like that. It's a bit of yes and no, to tell you the truth, Joe.
Okay.
So it's no, it's not here we doge again because a lot of the legislators are brand new to session coming off last year's election cycle, of course. So for many of them, this is their first go around being elected officials here in the state. But there is a sense of yes, just because some of the federal activities around DOGE and streamlining government spending are coming to the shores of Florida as well. So there's been a few bills filed, or at least discussion points around taking a look at how public funds are spent in the state of Florida. There will be some healthcare impacts on that. They are looking at academic training center budgets, as well as looking at some of the how we regulate medical professionals in the state. So there is a bill out there to actually remove the boards of some of those medical professionals, including athletic trainers and opticians. And I think the athletic trainer is the one for our medical societies that have been flagged for us as potentially being of concern, just because eliminating their board of athletic trainers will eliminate a little bit of their ability to self-regulate the profession and all the strides they've made in patient safety or athlete safety on the fields across the state could potentially be impacted. So that's one to watch as the state of Florida dives headfirst into this kind of Doge reality that we're all living through. We'll see what that kind of brings to the state of Florida.
Okay, and yeah, and that obviously that covers a lot of different things, but as these little tidbits come out as how it affects the healthcare community, we'll keep an eye on it throughout the session and let people know every week if there's a new little wrinkle that needs to be covered. So that's a good start. That was a good headline as well. Let's keep it rolling here. Several bills that have the physician community concerned received early momentum in week one. Is this a sign of a rocky road ahead, or is this just kind of what we expected?
Well, typically, if bills get heard that first week, they've been teed up. There's some momentum. There's some potential leadership support behind them. So it's certainly an ominous sign if there's bills you're concerned about. And two in particular, we've already talked about in previous weeks on our legislative preview sessions, one being wrongful death and the other one being CRNA autonomous practice, both advanced this week. So wrongful death passed out of one committee in the Senate and one committee in the House, and the CRNA bill passed out of a committee in the House. So it is a worrying sign. There are definitely two issues that the medical community is taken very seriously. We've talked about wrongful death quite a bit. Florida is a bit of an outlier in how we treat the ability of adult children and parents of adult children to sue for pain and suffering in the state. There are other states that limit the amount of non-economic damages those folks can receive when they do access the courts, but Florida has a total ban. So it's been a target for a while. There's some great data coming out from the Florida Justice Reform Institute, which is a pro-tort reform organization, talking about how Florida's medical malpractice liability climate remains the worst in the country. The healthcare tax that all patients pay and all physicians pay here in the state is above any other in the country. So we remain concerned that opening up this pool of litigants to additionally or provide additional lawsuits or malpractice claims against physicians is going to really impact that situation worse. And the CRNA autonomous practice too has us concerned as well. there's a bit of a misnomer that potentially other physicians, non-anesthesiologists, could provide adequate supervision to CRNAs practicing on their own. But we talked to many surgeons, orthopedic surgeons, and others who would be really worried about allowing an unsupervised CRNA to put their patient asleep just because of the liability concerns they have and the potential danger for the patient if something goes wrong. Again, 90% of the time, a CRNA may be perfectly fine in dealing with a situation, but it's that 10% where really that extra residency training and skill set needs to kick in to potentially save a life or improve an outcome. So something we're definitely worried about. Again, we didn't see any action on the Senate side on the CRNA bill, so we're not sure if it's going to move over on that chamber. But we are watching both of those, and it could be a rocky road. I would say definitely for wrongful death, since it was heard in both chambers the first week. That's not a very good sign.
Well, it's interesting that you mentioned the data coming out because that was one of the things that the lawmakers brought up when we were over there was asking about the data and how this would change things. But it's hard to quantify that when you're talking about a bill that hasn't passed yet and what would happen when a bill passes. It's hard to really kind of put that into the numbers until it happens, if it happens. So interesting point that you brought up that some numbers have been coming out.
Yeah, and obviously Florida, we'll talk in a little bit in the next question, a little teaser there. But there's some of these toward expansion bills that are moving that normally you would not see or expect in the state of Florida since we're a Republican supermajority but all these efforts sort of are lining up that are creating some concern from the physician community for sure.
All right. Well, nice segue. Let's go into our third headline today, Fraser. Now the session has started and the legislative field is set. Several new issues emerge that warrant attention. So let's just keep it rolling. What's that mean?
Yeah, so we've been warning folks that bill drafting was a little backed up this year and bills had not emerged yet. So our poor lobbyists over the last week, I think thousands of bills dropped. So they are scrambling through all of them to kind of figure out what each of those bills proposes and what the potential impact would be. But a few to mention, a bill around electronic prescribing has emerged. Currently, the state of Florida um, asks physicians to electronically prescribe all their prescriptions for their patients, but it has some carve outs for situations where patients may need a written script to take with them. This bill really ratchets down on those exemptions and may make it harder to write an actual script. So we're watching that. Obviously, one of those exemptions is the ability for patients to shop around and find a better price, or if their pharmacy doesn't have a drug they need, they can take their script with them and go to the next pharmacy. I think most legislators feel there's this magical cloud with prescriptions out there where if a physician prescribes a drug, any pharmacy around can grab it, attach it, and fill that. But that's not the case. It goes to one specific pharmacy. It's really hard to transfer a script from one pharmacy to another, even within the same chain, sorry. So obviously we're concerned for patients being able to access their meds timely on that one. There's a blood clot bill which is trying to deal with the incidence of blood clots that are a serious medical condition, known complication for many surgeries, but it's going to create a registry in the state with some enhanced assessment and follow-up requirements on physicians. Again, that there is some concern that potentially that opens up more litigation for physicians. So if you walk through that plot, you've got here three bills moving that you might have a CNA autonomously practicing, putting your patient to sleep. You have to do this enhanced blood clot monitoring and follow up and potentially more adult children seeing you from the back end. So that's where it kind of comes together. You put all the pieces together as a worrying little train here toward expansion for physicians. And then one more is sovereign immunity. So, and this bill's been around for a number of years, trying to look at how all government officials currently are capped in the sovereign immunity amount they would have to pay if they are found at fault in an incident. And currently that cap is at 200,000. It hasn't been raised in a long time, but there's a bill to jump it up to $1 million, which again for public entities like our academic training centers, that's a huge issue to have that large of a jump in immunity costs potentially, especially when the state asks those institutions to train physicians and future physicians. The state is asking them to take on risk, and at the same time, this bill would enhance their exposure significantly. So we're having ongoing conversations about that. But I don't want to be too much of a Debbie Downer, which I already have been. There's a few good things that have emerged too. Again, our
Thank goodness. Golly.
I know. There's the bill we talked about previously on retroactive denials. That bill has landed with a bill number in both chambers. The other thing too is it prevents insurance companies from requiring physicians to accept credit card payments. How they get reimbursed for providing services. Some of the insurers have been only giving them one option, which is to use their credit card, which is then a 3% fee passed on to the doctor. So basically cuts the fees. And for some practices, we've heard those admin costs have run upwards of 100 grand a year just because the insurance company gives them no other option. So that's going to be huge relief for our physicians if we can get that bill passed. And there's also some protections for patients around formulary changes on their prescription drugs as well. So it's not all bad news. There's some good stuff going out there. It's just unfortunately it's human nature. We kind of focus on the bad things first.
Yeah, yeah.
But
I was worried when you were, rattling through that list. It was, hey, three topics and not much good news, but there is a little good news. And the other thing is, it's just week one. Obviously this is the headlines that we're starting off with, but there's a long way to go. And obviously these things are priorities out the gate, but they could lose momentum and other things could kind of come up to the top of the list. So I'm glad
yeah.
you had a little good news for us today, Fraser.
Yeah, for sure. It is a big funnel here. So we've got thousands of bills we're watching. They'll start to narrow down and it'll make our lives every week a bit easier because we're not trying to track hundreds of bills, but we'll actually narrow the funnel a bit and really focus on those that really have a good chance of to pass. I think the stat is something like there's 3,000 bills filed a year and only like 200 usually pass. So again, that funnel will and our focus will train on those that really do have an opportunity to pass this year.
That sounds great. That sounds great. Well, any last thoughts? I mean, I know we have one more thing we have to discuss, but before we move on to that, any more thoughts on what happened in Tallahassee this week?
No, I think overall it was a reasonable week. At least the week is over, I guess. That's in my new positive light. That's what I'll say. We are looking ahead to what bills are going to be heard next week, and certainly we'll let everybody know if there's any bills that deserve some action. I do know this week I gave you a little bit more time to think about the musical mention that you want to pass along to our viewers. So, Joe, I think before we close, we need to wrap up with that for sure.
Okay, and I want to say I worked hard this week. I did a lot of my regular duties, but I did put a lot of thought into this, so it took a little time. Last week's or the couple weeks ago when we did this, it was a Billy Strings song. So every week I'm going to give everybody a musical artist and a song from that artist that they can listen to. And I was telling you beforehand that I really want people to, if you were to put every week together, have sort of a playlist that you can, listen to while you're doing yard work or whatever it is. So the first one was kind of Billy Strings with a bluegrass, bass to him. So I didn't want to jump to like hard rock or anything like that next. So this week's pick, and I also kind of wanted to make it Tallahassee focused. So the guy's name is Daniel Donato. The last name is Donato. And when he performs, it's Daniel Donato's Cosmic Country. And the song I'm picking today is it's because I live in Jacksonville. A lot of our doctors live in low-lying areas of the state. Here in Jacksonville, the biggest hills we have are the landfills, and everything else is sea level. But when you go over to Tallahassee, it's a different landscape. You're driving up and down the hills. You kind of feel like you're in a little more hilly region. So the song by Daniel Donato this week is High Country. He's singing about the mountains and things like that, and kind of getting back to the mountains. But I picked it because if you're over in Tallahassee, it's a lot different than Jacksonville. It's a lot different than Tampa as far as the elevation changes and things like that. So I think people will like it when he performs in concert. He's Daniel Donato's Cosmic Country, so it's a little bit of a country twang to it, but it's we're getting toward rock and roll each week. So check it
Awesome.
out. Check out Daniel Donato and his song High Country. And kind of when you're playing it and tapping your toes, think about driving through those hills of Tallahassee and kind of what's going on in Florida's high country over there.
I love it. Out of this world, Joe. That's great. I got a little
Yeah,
nervous there. I got to tell you, when you started talking about high country, I thought we're talking about medical marijuana legislation again, but I'm glad you steered clear and explained it. It's the mountains,
right. This is just
the
elevation
hills.
changes. Yeah,
Okay.
yeah. This is just when and it is true. I mean, you've spent a lot of time in Tallahassee. You go out there and you're waiting at a red light and you feel like if you're in neutral, you're just gonna go back down the hill. So check it out, Daniel Donato's Cosmic Country, and the song is High Country. And once you listen to that, you'll listen to some other stuff. And I like to go see a lot of live music. The only time he's come to Jacksonville was on the day of my daughter's first birthday party. So I missed the concert. Obviously, I wanted to go spend the day with my daughter. But if he comes to your town, go see him. He's a great musician. And real quick, I'll tell you, when he was a young boy, he got his chops as a musician because his dad would take him into the city center and just drop him off all day. So as he was 10, 11 years old, he would just play for people in the streets and became, just a really good musician. So check him out. Check him out and see. Tell me if you like him.
Fantastic. Great tip, Joe. This was fun. Look forward to
Yep.
doing it again next week.
All right. We'll have more headlines. We'll see you next week, Fraser.